Hello and welcome to our weekly COVID update for the town of Plymouth. I am not Steve Triffletti, I am Matt Muratore. Steve had a conflict today, so I am proud to be hosting this in his place, but don't worry. Steve will be back on the air this week. He'll be here tomorrow at 6 o'clock for the on PAC TV for the town meeting preview as his role of town moderator. So you'll still have Steve this week, so don't worry about it. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon's channels 43 and 47. And you can also watch this on PAC TV's streaming channel by going to pactv.org/live for questions during today's forum. And please email plymouthinfo@pactv.org during this telecast for any questions. And these forums can be replayed at pactv.org/Plymouth. So today, and these are every Wednesday we will be on from now into the immediate future. So today's lineup includes, of course, the chairman of our board of selectmen, Ken Tavares, MD at the attending physician at BID, Dr. Philip Triffletti, Dr. Barry Potvin, Professor Emeritus at Yeshiva University, Department of Biology, and he's also the chair of the Plymouth Board of Health, Dr. Chris Campbell, Superintendent of Plymouth Public Schools, Michelle Bratti, Director of Elder Affairs for the Center for Active Living, and Amy Naples, Executive Director for the Plymouth Area Chamber of Commerce. Now we're going to go to our chairman of our board of the town of Plymouth, Ken Tavares, for his opening statement. And Ken, you got some ballot information update for us?
Yes, I do, Matt. I'm very pleased to report, after a conversation with our town clerk today, that approximately 50% of the ballot requests have gone out, and she anticipates that the remainder will be in the mail by next Tuesday. Early voting will start on the 17th, and a complete listing of those dates and times are available on the Town of Plymouth website. But thanks to Pearl, her crew, and their organization, we're very optimistic that it's going to be a smooth run getting the ballots out to people and then, of course, back in. Also, the town has been in discussions with Dr. Potvin and the Board of Health. We're looking at plans that, if necessary, could be implemented sometime, going forward. To have the time to do some advanced planning is important, and we do want to emphasize again, masks. Masks are important. We're noticing that there are a number of areas where people are wearing them. There are still some resisting. But in order to prevent the spread of this virus, we all need to wear those masks, wash our hands, and keep the distance. It is just so important. Plymouth, and then I'll leave this to Dr. Potvin, is starting to see an uptick, as we are throughout the United States. But again, it's up to us to try to curtail this and do the right things at the right time. Thank you, and thanks for filling in, Matt. You're doing a good job, but I know we'll have Moderator Triffletti back tomorrow. I think that's at 6 o'clock tomorrow night.
That's correct.
Thank you.
Yeah, thank you, Ken. Thanks very much. Appreciate that. Now we're going to go to Dr. Barry Potvin, who is the chair of the Plymouth Board of Health. Barry, you hosted a meeting yesterday with town leaders. Can you talk about that a little bit?
Yes, yes, I can, but it's going to be part of other things I'm going to be mentioning also. So with regard to our meeting, we have assembled a number of people that are all important officials in the town, including Ken Tavares and Mike Muratore, the police chief, and quite a few other people, members of the schools. So we're trying to really increase our conversations and collaboration with a number of important players here in Plymouth, and I believe we're doing so. One of the things that came up, which is the first thing I wanted to talk about today, was actually Halloween. So just yesterday, Governor Baker came on the news and announced that there would be no statewide trick or treat ban. And he explained the reason for this is that he felt that it would likely, if there was a ban, it would likely lead to thousands of private parties, which would likely be even more risky. So again, a lot of the concern is about gatherings, and the gatherings can be either these large gatherings at various areas outside and inside, or they can certainly be private parties. And that's one of the major ways in which this virus can be transmitted. If you do choose to go out and do trick-or-treating with your children, then please try to keep the group small. And also remember that everyone must be wearing masks, and those masks do not include the Halloween masks because they provide no protection whatever. And please also do not have your children or yourselves wearing protective masks underneath the Halloween mask because it may make it a little bit more difficult to breathe. Another issue that I wanted to talk about, and I know Mark Wilson often says, well, I've gotten these questions, so I'm going to answer them. A lot of people don't fully understand contact tracing and how important it is in controlling the pandemic and what we're seeing both nationally and statewide and in Plymouth. So contact tracing has to be done very, very quickly. The schools are doing this a lot. So is the Department of Public Health. So is the state. The one thing that you have to keep in mind is that it's only as good as the cooperation that you get from the people that are being contacted. So not only do you have to contact them quickly, you also really have to make sure that people are giving you accurate, complete information. In some areas, in some countries, when they do a contact tracing, they find that each person they contact gives them at least 15 other names of people they've had contact with. But in other areas, they're lucky if they get one or two. Why? It's probably because a lot of people don't want to list names of their friends that they've had contact with because they know if they do, these people are going to be put into quarantine and they don't want their friends to undergo this. But by not giving the names, it really puts many, many more people at risk for getting this disease. So if you ever get contacted again, please make sure that you are very complete in the information that you give out so that we can try to keep this under some control. Some numbers that have come up recently, this is just from yesterday, and this to me is kind of scary. I know we've heard advice that you shouldn't be afraid of the coronavirus. I'm sorry, but I'm afraid of the coronavirus, have been ever since this started. Why? Well, in the United States, there's been 7,436,298 cases with 209,560 deaths. In Massachusetts, the number is 133,359 cases and 9,323 deaths. This is frightening. And also they've noticed recently that the 3-day average hospitalization rate has been going up in Massachusetts. It's now at 468. In Massachusetts, however, on the positive news, we still rank 25th out of 50 states, plus the District of Columbia, in cases per 100,000 over the last 7 days. So we're nowhere near the top in terms of numbers of cases. And among the states that are the highest are still the ones in the southeastern part of the country. And Wisconsin has been having some difficulty of late. In Plymouth County, there's 10,007 cases and 777 deaths. In Plymouth, the town of Plymouth, our home, over the last 13 days, there has now been 70 cases that were positive. That's a big increase from what we've been seeing in the past. At some times back in June and probably into July also, we're seeing very few positive cases popping up over this time period. There's been now a total of 760 new cases and 76 deaths here in Plymouth. And a lot of it seems to be coming from the people that are in the 21 to 30 age group. Second highest group would probably be the teenagers and the ones that are up in the 31 to 40 age group. So we're desperately trying, and this is one of the reasons we had the meeting yesterday at 2 o'clock, to find ways that we can reach out to these people in those age groups to try to encourage them to be more cautious and to keep in mind that what they're doing and not doing really does affect an awful lot of other people. that they have contact with. Finally, I wanted to mention that there's a case, and this just gives you an idea of how important it is to be careful with what you're doing, came from the CDC's weekly morbidity and mortality report. A teenager who was most likely infected previously spread the disease to a bunch of people in her family, and it included probably at least 12 out of 14 family members that were gathering together for a 3-week celebration. And they usually often showed symptoms not until 14 days after they were infected. They found out from this that most likely, and this relates to what goes on here in Plymouth and in our school population as well, since she was 13 years old, they discovered that usually people who are in their teens are much more likely to be infected and spread the disease than those that are younger children. There's probably a lot of reasons for this, but you can sort of speculate to your heart's content. It doesn't make any difference. The people that were infected in this family group were not wearing masks, and they were in close quarters. And that seems to be a common sort of thing that's happening in many different places. Many of these people were actually tested by this rapid antigen test, and 4 days after they were exposed, they didn't show a positive test with the rapid antigen test. 2 days later, however, this young girl who was 13 started to show nasal congestion, but showed no other real symptoms. She later on, of course, tested positive, but this also shows you that these younger people generally don't have much in the way of symptoms. They don't necessarily get really severely ill, but they certainly can spread it to a lot of other people that they come in contact with. So we have to keep that in mind, and this pertains a lot to people who are not yet infectious or people who are just asymptomatic completely. So that's the update for today. I know that there's going to be a lot more information. I see that Dr. Triffletti has joined us, and I'm sure he has a lot to say about local issues as well. So thank you, Matt. Let's turn it over to the next speaker.
Great. Thank you very much, Dr. Potvin. We really appreciate your information. Now I want to turn to Dr. Phil Triffletti. Dr. Phil, lots happened in the last week. The president was come down with COVID, and there was extraordinary measures because he's the president. But what do ordinary people go through when they have COVID, when they have to go to the hospital and get tests and things like that?
Yes. So I'm going to talk quite a bit about the White House incident so people can, I think, interpret what they need to be doing. But, there's 5 major takeaways that I want to take from this White House event. I think it's a very unfortunate situation for the president as well as those around him. But I think there's a lot to be learned about, where breakdowns occurred and, how people could protect themselves better. The very first thing I would say is that you may have heard in the media, they did some rapid testing of all these people who had attended the Rose Garden event and then subsequently a reception at the White House for the Supreme Court nominee. And those diagnostic kits, Barry was kind of referring to some of this as well, they're probably 97% accurate if somebody has symptoms. But if people are asymptomatic, it may only pick up 2/3 or maybe 67% or so of people who might be infected. So they're not really reliable tests. When you're using it as a preventive strategy, it's not reliable. So, if people are going to the hospital to get testing or other places, it may add some layer of prevention, but you still need to be performing all the other preventive mitigation strategies that everybody is familiar with. So I think the White House, they really had a false sense of security about the fact that they were rapid testing everybody. And then once they got inside a bubble, they're thinking they have a bubble. And, you don't really create a bubble that way. You could create a bubble with probably a quarantine. If everybody was quarantined for 14 days, then you could be more satisfied that there's nobody in there that's infectious. But people coming off the street and just taking a rapid test, doesn't help them. And so, preparing for today's broadcast, I was looking up hubris which stands for dangerous overconfidence. And so I think that that's really what you're seeing when they were using this test as a strategy to protect the president and all those around him. There was dangerous overconfidence in how this test works. The second point I want to make is that I'm just going to say indoors is bad. And, I've often called this a very sneaky virus. I think you may have heard in the media, the CDC has gone back and forth about listing on their website whether this virus is airborne or not. And that is a very, very important and serious distinction, and really, plays out a lot in what is the most effective ways to avoid infection. Around May, June timeframe, the World Health Organization was approached by over 250 scientists who wanted the World Health Organization to endorse the fact that the virus was airborne as opposed to being a respiratory droplet, which is different. And even Dr. Fauci, in all the communications that he's had in recent months, I think he's pointing more towards his conviction that it is an airborne virus. And I think, seeing how contagious this is and how contagious it was in this super spreader event at the White House and other super spreader events, I think we can see that it's a much more contagious type of virus. Airborne viruses, as examples, would be things like measles, tuberculosis. And the big difference is that these infection particles, they stay suspended airborne in the air, sometimes for hours, sometimes for days, in closed spaces. So that's why it makes, indoor gatherings so dangerous. And then if you add to that you're not wearing masks, you're in a much more precarious situation. So, I think when you're indoors, you can try to do social distancing, but if you have an airborne virus, it's going to be floating around for a while. 6 feet's not going to probably be enough distance, so it's just too dangerous, really, to be indoors with large gatherings without masks. I think that's the bottom line. The third thing I think to take away from the White House issue was the gathering size, and I heard one expert on TV, talking about, to avoid super spreader events, having gatherings of 20 or less. I think that's part of the reason that our governor has sort of kept indoor gathering recommendations to 25 or less. You probably have noticed a lot of colleges are trying to keep the college students to have less than 10 people gathering at once. And, we know from, events like the Biogen, where there was probably over 150 people, the Millinocket wedding in Maine, where there were 65 people, that, you have these large gatherings and you have the opportunity for the virus really to spread amongst a large number of people. And then those people can leave that event and go and spread it to others. And you can end up with, in Biogen, it was 20,000 people got infected. The Millinocket one was at least 150. And, there were many deaths, associated with that event. The fourth thing I think you can take away from the White House is that wearing masks is important. I talked about this on previous broadcasts, that, there's some evidence that, you're 5 times more likely to avoid infection if you're wearing a mask. So, I think we can't emphasize mask wearing enough, especially when you're indoors. So that has to be continued point of focus, as others have already mentioned on today's broadcast. And then the last thing, I think a big takeaway from the White House is, you don't want to follow what President Trump is doing right now. He's infected. He should be isolated. And the fact that he would go into any closed spaces with other personnel in the White House and not wear a mask, he shouldn't even be out of his bedroom. He should, we would normally say you have to stay in your own room for at least 10 days after the onset of symptoms. If you have no symptoms, no fever, for several days, at the end of the 10 days, you can come out of your isolation, but he should be in strict isolation. Some people, of course, have said perhaps he should have just stayed in the hospital for that, and that would have been great. But, I think that that's another lesson to take away, is that if you do get infection, you're infected, you have to keep yourself isolated away from others so you don't spread the infection. The last thing I want to talk about, when I was preparing for this talk last week and had some technical problems, I want to talk a little bit about the vaccine, because I think, getting to having a vaccine really is what we need to get out of this pandemic. And so I was doing a little research on how this process will play out. So it turns out the CDC will be responsible for distributing the vaccine to states. And they've been working with several national advisory boards and experts on, how to prioritize the use of the vaccine. As you can imagine, we may only have 15 million or so vaccines in production and available at the very beginning. We may need over 200 million vaccines. And so, there will be a little bit of catch-up time there. And so they are looking at priority groups. You may have heard of like healthcare workers, possibly nursing homes, other people who are older or sicker, and maybe prioritized first to get the vaccine. But it's the CDC who's going to make these decisions. It's going to be somewhat complicated. Some of the vaccines you've probably heard, like the Moderna and the Pfizer vaccines, have, really very strict refrigeration requirements, minus 20 degrees, minus 70 degrees refrigeration, short shelf lives, as little as 10 days. So some of these vaccines may have to be given out, through a distribution site. These vaccines will not be able to be distributed like other vaccines that get sent to pharmacies and other, local community outlets. The Johnson & Johnson vaccine, that Dr. Baruch is working on at Beth Israel Deaconess Medical Center, has some advantages, doesn't have the refrigeration requirements, and also has a much better shelf life, and it only requires, one shot as opposed to the other ones will require 2 shots. So that's, depending on which vaccines make it to the market, we may have a little more flexibility, but the states are submitting plans to the CDC that's in process about how they plan to distribute and administer the vaccine. So it will actually be up to the state, Massachusetts government about how those vaccines are ultimately distributed. Some estimates have said it could take up to 2 years really to have a full production and distribution of vaccine. I think that's the horizon that we really have to be looking at when we think about what's going on with the pandemic. So that's all I have to say to start. And of course, as always, I'm happy to take questions later, and I'll have a few final comments to summarize later. Thanks, Matt, for having me on the program today.
Yeah, thank you, Dr. Triffletti. We appreciate that. And we actually were on a conference call yesterday with the governor and lieutenant governor, and we're hearing the vaccine. We're probably looking for the vaccine sometime in the second quarter of 2021. So more information on that will be coming. Again, we're going to take questions at the end. If you have any questions whatsoever during this broadcast, please email plymouth.info@pactv.org. Now we're going to head over to Dr. Chris Campbell, the Superintendent of Plymouth Public Schools. Chris, you got over 7,000 students that have been attending for almost 3 weeks now. How's it going?
So far, so good, Matt. I think we've had a lot of preparation that went into our return, and our students have really stepped up and done a remarkable job. Our families have been extremely supportive, and our teachers have done a phenomenal job as well. So I do have some updates related to that, but I feel very cautiously optimistic as long as we continue to do our part. So it's good to be here with you all, and thanks for having me. So I wanted to provide the community an update on a few items related to COVID and the Plymouth Public Schools. So first, something new, we've added an icon to the bottom of our website, and you'll see that in the bottom of our screen, our home screen, and it says COVID-19 case updates. And if you click on that, you can get to a number of resources related to our health service resources and COVID updates for the district. We've added a data dashboard. So this is our 3rd week actually for this, the Plymouth Public Schools. We're very committed to transparency as we communicate information pertaining to COVID-19. And this dashboard, we believe, is a good source of information for our members of our entire community to remain updated on the most accurate COVID-19 data related to our district. So this dashboard will be updated weekly. It's not updated daily. It's updated weekly by 3 p.m. Each Friday. So we've added that to our website, as I said. And we've also added updates from previous weeks. So at the bottom of that dashboard, you can click on that and you'll see the data and the trends over time as we continue to be in school. On the same website, you'll see that there's a number of resources. We continue to expand as many resources as we possibly can to our families, to our community. We've added two very well constructed videos. The first one is about primary prevention strategies. This was done with our health office in collaboration with a number of our nurse educators here in Plymouth. We also have a great video on secondary and tertiary prevention and what we do as a school community. There are other updates for my office that are also available on the bottom of this webpage, as well as important information from the CDC that we found very helpful to our students and to our families. Some information from the National Alliance on Mental Health as it relates to COVID-19, how to talk to your children about the coronavirus, and then a lot of great resources from the Massachusetts Department of Public Health in relation to COVID-19. I can't stress enough, it's also important that our community understands how we handle COVID-19 related situations and scenarios as they arise. It's really important for the community to know, in my opinion, that we're not working in isolation. We have been collaborating with a number of departments and professionals since before opening school and preparing for these situations. So to date, as you can see on our data dashboard, we've had 5 positive cases across the district. Now that we have schools underway, we've had to proactively address and manage a number of scenarios around COVID-19 infections impacting our students and families. So in each case, when these students have been impacted by COVID-19, we've consulted on a case-by-case basis with the Massachusetts Department of Public Health epidemiologists. We've utilized our Department of Elementary and Secondary Education and DPH guidance, and we've worked very closely and collaboratively with our public health director and our school physician. And we're in constant contact and have great collaboration with Dr. Potvin, our local Board of Health chair, who's with us today. It's really been a wonderful collective collaboration, which is continuing to be a significant support to our district as we manage situational occurrences related to COVID-19. So we did send a letter out last week, communicating and highlighting this collective collaborative partnership, but I just want to emphasize it today so that the community knows that this is something that's not done in isolation. We have a great team, and I feel very fortunate as the new superintendent here in Plymouth to have such a wonderful community to gather around and to do this great work and this important work together. Lastly, well, not lastly, but one other thing that I wanted to mention is technology. So as you know, when we closed last March, we had an abrupt ending to our face-to-face school and we went remote. And we had a lot of challenges around technology. We have distributed over 2,000 Chromebooks to date since March, but I wanted the community to know that we have utilized a significant amount of COVID grant funds and other grant funds as we look to move Plymouth towards a one-to-one situation. So I think we all recognize the availability of a device is no longer something that is nice to have. It's essential to the way we operate in schools these days. And we've ordered thousands of Chromebooks months ago, but like all school districts across this country, the shipment of these devices has been considerably delayed due to the unprecedented demand across this country. So we've recently received 1,000 devices in our tech center, and we anticipate several thousand more in late October, early November. Some districts are waiting until February or March because there's such a demand. So I feel fortunate, relatively fortunate, that we'll have our devices in hand by November. So as soon as the status of these devices is confirmed, we'll be communicating to our families as to how we will be releasing these devices to students. So keep in mind, we have lent out, as I said, approximately 2,000 devices to date across this school community since March. So lastly, I would like to say our students and staff have done a remarkable job in practicing primary prevention strategies in our schools. And really, I can't stress enough how happy I am. Our students are so happy to be back at school, and they're doing everything they can, everything that they need to do, along with our staff, to make sure that we're doing our part when we're in school. It's critically important, though, that we maintain our vigilance outside of school. I can't stress this enough. We all need to do our part outside of school so that we can stay in school and hopefully return to more routine conditions in the near future. So I just want to highlight just the great work. I'm really cautiously optimistic and pleased with how things are going, but I can't stress enough, we need to continue to do our part as a community when we're outside of school so that we can stay in school and hopefully get back to more routine conditions. So thanks again, Matt, for having me.
Thank you very much, Dr. Campbell. I appreciate it. And as a parent and on behalf of the thousands of parents in the Plymouth Public Schools, we thank you and your staff and, of course, all the teachers who are real heroes in my eyes for what they're doing to keep the kids educated and I think more importantly engaged with their peers and activities that are going on. So thank you so much for what you're all doing. And thanks to Carolyn Rains too, overseeing all those nurses and what the nurses are doing. So we appreciate that. Next we have Michelle Bratti, who is the Director of Elder Affairs for the Center for Active Living. Michelle, we welcome back some seniors again, so didn't we?
Yes.
And look, I have my mask today. See?
I love it,
All right.
Matt. Thank you
Great
so much.
mask. Great mask. These are
Perfect.
great for seniors.
I love it.
Great for seniors.
Local business, G&G Silkscreen,
There you
local
go.
business,
There you go.
support local businesses.
So how's
Thank
it going
you.
there?
Thanks, Matt, so much. Impact TV. And hello, as always, to this esteemed panel. It's good to see everyone. And Dr. Campbell, I second what Matt just said. You have a daunting task and you are doing a fantastic job. Hats off to our schools here. I do want to actually talk about some outstanding programming that is being offered at Cal during these challenging times. We have a great mix of options, and I truly hope our seniors in Plymouth take advantage of the opportunity to engage with their peers, whether it's at our facility or from the comfort of your own home. Social isolation truly has serious and damaging effects, and staying safely connected is critical to mind, body, and spirit. We have indoor programming, outdoor programming, while weather permits, Zoom programming, Zoom Senior Learning Network, Zoom Senior College, and PAC TV television senior programming. For outdoor programming, we currently have 3 programs. These include mindful movement, heart and hand, and Tai Chi, which are all low impact exercise programs. For indoor programming, we are offering 7 different programs on various days, including some support group rotation. I would like to note, I hear this panel has such excellent advice from our medical esteemed professionals. And we also agree at Cal that indoor programming, 6 feet's not enough. From the get-go, we decided, because we had the space, that our social distancing inside is at least 11 feet by 15 feet in between people. So I want people to feel comfortable, and masks are absolutely mandatory at the center. The 7 different programs include a BIG, which is a Parkinson's movement class, very important, core and more exercise, cardio dance, mindfulness and yoga for everybody for centered grounding, and an art class called watercolors. All of our exercise classes are also low impact. Please know that for both programming, indoors and outdoors, all social distancing protocols, rules, and regs will be adhered to and are strictly enforced. Your safety is our priority. Details regarding all of our policies and what you can expect at Cal, including a video starring the Center for Active Living staff and a cameo appearance by our Community Resource Director, can be found in our constant contact email, on our Facebook page, and on the town website under the Center for Active Living. I encourage everyone to familiarize yourself with them so that you know what questions will be asked of you prior to admittance and what the new protocols look like. For indoor programming, we'll be asking you 3 questions regarding COVID, taking your temperature, having you hand sanitize upon entry, amongst other details. We want to take our time and do it systematically correct. We are not in any hurry. Patience is a virtue here. Again, our video shows these procedures in real time, so check it out. If you ever have any questions or concerns, you know, as always, please do not hesitate to reach out to us directly at 830-4230. Examples of Zoom programming include Hot Topic Discussion Group, Bingo, Barefoot Cardio, Shake Your Soul, and various yoga classes. The Senior Learning Network is an exciting opportunity to take a virtual tour of some of the most fascinating places around the world, like the Yellowstone Park and the Museum of Modern Art. Or maybe you'd like to learn about Eleanor Roosevelt at the FDR Presidential Library. Our senior college, in partnership with Bridgewater State University, offers an interesting and amazing range of college-level learning opportunities, specifically designed for those 50 years plus. It is only $55 for the fall semester for unlimited enrollment. So take this opportunity to stimulate your mind, engage with others, and increase your knowledge base from the comfort of your home. Thanks, Matt.
Thank you very much, Michelle. We really appreciate all you're doing down there for our seniors. Now, Amy Naples, who are Executive Director of Plymouth Area Chamber of Commerce, actually had a conflict, but hopefully we'll get her back next week. She's actually at a Small Business Association agency Zoom meeting as we speak, which is very important for our business community that she be on that. So, but I do want to give a quick update on behalf of Amy. Starting Monday this past week, we have moved into step 2 of phase 3 for the economy, for our businesses. We are still considered a low-risk community, so we were able to do that. The indoor performance venues now go to 50%, so those centers like the Spire Center can actually go up to 50% with a maximum of 250 people, and with outdoor capacity being the same. Recreational activities, trampoline parks, those of you who want to go to trampoline parks, obstacle courses, roller rinks, or if you want to do laser tag, you can do that at half capacity now at these places that just opened up. Retail stores, if you go into a retail store now, as you know in the past, fitting rooms have not been open. They are now open, so you can do that. We have gyms, museums, libraries, driving schools, flight schools, all open, of course, with following the protocols that are in place. And as Dr. Potvin and Dr. Triffletti indicated, gatherings are still at 25 for indoor, and outdoors 25. And there are still 20 plus towns in Massachusetts that are on that are communities that are in the red, that are trying to work their way out of that. So we continue to work with those communities to try to get them the help to get them out of the high risk into low risk. And also yesterday, the governor did talk a little bit about Halloween. The thinking of having Halloween and not having Halloween parties is really the key, but it's up to the local communities on how they want to do that, following the right protocols, social distancing, wearing masks, hand washing, etc. So we want to continue to follow those protocols, but I know that the chairman of the Board of Selectmen and the chairman of the Board of Health will have more to talk about in the upcoming days and weeks. With regard to some of the stats with here in the Commonwealth, Dr. Potvin gave you Plymouth and Plymouth County. With regard to the state, when you look back on September 15th, and now here we are 3 weeks later, we were at 0.8% of the 7-day rolling average of those confirmed with the coronavirus. We're at now 1.1%. The threshold is 5%, so we're still doing well, one of the best in the whole country. However, it's going up slightly in the wrong direction. With regard to the number of tests, since September 15th, we've had 350,000 more tests done since then. We've also had the hospitalizations have gone up from 371 on September 15th up to 494. But to give you some perspective of that, we had almost 4,000 hospitalizations at the height of this back in April, late April, early May. So we do have 148 more people in the hospital. And we also have those that are in the ICU went from 52 in the ICU in hospitals throughout the Commonwealth up to now 85. And those on vents have gone up, was 23 folks who are on ventilators on September 15th. That has now gone up to 31. And right here at BID Plymouth, that has shot up a little bit as well. We were at 23 folks in the hospital at BID Plymouth Hospital here in Plymouth on September 15th. Now we're at 41, and of those, 4 are on ventilators. The long-term care community continues to do a good job of protecting the seniors in our facilities. Again, long-term care facilities, our nursing facilities, their assisted livings, and their rest homes as well. The death rate, though, has gone up in the last 3 weeks by another 235 folks based on the corona numbers that we're seeing. We are in a better position than we were back when this all started. We understand this more. There's more testing that's being done, tens of thousands of testings being done daily, which is a good thing. The tracing that's being done, which is another great thing that's happening. So we understand this a lot better now. The long-term care community and the healthcare community are in much better position than they were when this started. So we are seeing an increase, and we probably will see an increase, as the expert just talked about, with regard to folks being more indoors. But it just means we have to be more careful and wearing masks, even if you're at home, with folks and extended family over or friends over. That's where we're seeing a lot more of these cases coming out, as was indicated earlier. A lot of folks in their 20s and 30s and 40s that are getting it. They're maybe not going to the hospital, but they could be giving it to somebody that's elderly or at risk with their health. So we do have to continue to be vigilant with that. So with that, I want to move on to. I think we have some questions. I think we have a question that came in. If you have questions, it's PlymouthInfo@pactv.org. And the question says, given that the healthy people are claiming they have a medical reason for not wearing masks, has any thought been given to requiring a doctor's certification similar to the way we already handle parking permits? Has Plymouth added any personnel to increase enforcement? Any thoughts been given to deputizing wardens similar to how we handle parking enforcements? Dr. Potvin, do you want to talk a little bit about that?
I can try. Obviously, the enforcement issue is a big problem when it comes to face masks. We did have a discussion about this that was quite extensive yesterday, certainly with Mike Muratore, the chief of the Plymouth Police. The issue we really have is that, and this came up at Plymouth Rock this past weekend also, that if you ask people to put on masks and they tell you that they have a medical condition which causes them not to be able to tolerate masks, there's nothing you can do about it. You could ask them for medical excuses. I don't think we're permitted to do that. I know of one municipality in Massachusetts that said, fine, if you can't wear masks, you're going to have to wear a plastic face shield. But there's only one place I can think of that did that. I assume they would have to offer a plastic face shield in response to that. We have an issue because the enforcement mechanisms really require us to give a verbal warning and then a written warning before we can even consider anything more drastic like fines. And to do this, obviously, you have to have identification from the individuals that you stop. And we're really not allowed to ask for identifications. So it's a major issue in terms of trying to enforce face masks. But we're again also thinking about what's done in other towns. They call them COVID ambassadors, and they actually roam the main streets and try to counsel people to wear masks and to offer them masks if they don't have one. So all of that's being thought out, and all of it's being discussed very openly with our regular meetings that we have with a lot of different people here in Plymouth.
Great, thank you. Dr. Triffletti, is there anything you want to add to that from a doctor's perspective with regard to certifications?
Yes, I have had people come in and request, and I have given them letters, saying that they are unable to tolerate masks. And I know that I believe the governor and the state, had asked us to do that at the beginning of the pandemic. So even though there might not be any authority around that, I do grant those types of letters to patients when needed. I think it is a really difficult situation to be in, to not have more forceful, enforcement of wearing masks. I do believe still that, we're doing much better probably in the state of Massachusetts in most of our communities, even though, we may have occasional people that don't comply. I think in general, we've had very, very good adherence to recommendations on masks, and I'm thankful for that.
Yeah, thank you. And as a reminder too, those that do have medical conditions that cannot wear a mask or a face shield, then practice social distancing. Stay 6 to 12 feet away from the next person if you are out in public. If you're going in, don't go indoors if that's the case. You're wearing masks based on helping others. It's not just about protecting yourself, it's protecting others. And as we see what happened at the White House with the president, by having an event, it takes one person to get it and then it spreads through to everyone else. And it could spread to somebody in your family that could have a physical ailment that could cause them some serious issues, if not death. So remember that mask wearing is for everyone else's protection, not just your protection. So next week's lineup, we're going to have joining us Ken Tavares and myself. Steve Triffletti will be back hosting, and joining us will be Dr. Mark Wilson, the active professor emeritus at the University of Michigan School of Public Health Department of Epidemiology, Sarah Cloud, the director of behavioral health science and social worker at BID Plymouth Hospital. Justin Dominguez is the director of athletics for the Plymouth North High School. Sheriff Joe McDonald from the Plymouth County Sheriff's Department will be with us. Michael Jackman, the district director of Massachusetts Congressman William Keating, will be here, along with Heather Cosby, CPA, and we're going to try to get Amy Naples back as well, the executive director of the Plymouth Area Chamber of Commerce. Now I'm going to go back to the chairman of the board. I'm sorry, I'm going to go to, let's see, who are we going back to? We're going to go to, let's go to Dr. Triffletti. You want to wrap it up with any last minute comments?
Yes. First thing, I want to remind everybody to get your flu shots if you haven't had them yet. This is the time of the year to get them. It takes about 2 weeks for flu shots to become active. I haven't heard of any flu being reported yet, but you want to be prepared. If you're over 65 years old, I do recommend you get the high dose quadrivalent type of flu vaccine. So that's what you should be asking for if you go to a pharmacy, for instance, as opposed to the standard dose. The high dose is 4 times more potent than the standard dose, and it does seem to give people a much better antibody response. And studies have also shown people that get the high dose in that age group, they tend to have fewer deaths from influenza. So high dose quadrivalent vaccine for you if you're over age 65. The second thing is I just want to reinforce, I know the governor has been very concerned about gatherings that are what he calls unregulated. And I think, part of his position on whether we have gatherings in other settings, if they're regulated, at least we can make sure people wear masks, do social distancing, et cetera. But it's really the unregulated gatherings that we've seen with, high school parties, college parties, weddings that aren't adherent to the guidelines. These are all the things that could really result in quote unquote super spreader events like we've seen recently in the White House. So I would just encourage everyone to still be responsible about how they conduct gatherings, and try to keep gatherings small. If it's indoors, try to wear masks as much as possible. And wish everybody the best, stay healthy, and make every day count. Thanks.
Thank you, Dr. Triffletti. We appreciate it. Now we're going to move over to Dr. Barry Potvin, the chairman of the Plymouth Board of Health. Any last minute thoughts, Barry?
Yes, there's a couple. One which came up also because of what was going on in Washington, D.C., which isn't really discussed very often, is you should be very careful about traveling in cars with closed windows with other people who are not members of your own household. Certainly, if there's not enough air circulation and you're with other people, you may think they're healthy, they may be asymptomatic, but all it takes is one person in the car that is not wearing a mask when you're also in the car with them, and the chances of infection are very, very high. Finally, to quote Dr. Fauci, don't despair. We will eventually be able to go back to something more approaching our normal lives, But remember, the virus is still here with us. It's not going away. We're battling an invisible enemy. So you can't see these virus particles, even with an optical microscope. They're very, very tiny. So it's actually a battle, but our only defenses really are the face masks, the physical distancing, and hygiene, like washing your hands. Remember that what you do and you don't do not only affects you, but it also affects everyone else that you have any contact with. And it can also cause an impact that could cause loss of jobs, could damage our tourist-based economy here in Plymouth, and it could cause additional difficulties for our schools as they try their best to remain open and to serve all the students in person. So that's some takeaway messages. Thank you.
Well said, Mr. Chairman. We appreciate that. Now we're going to turn it over to Dr. Chris Campbell, Superintendent of Plymouth Public Schools, for any last-minute thoughts.
Thank you. I've highlighted the tremendous work and the commitment of our staff and students that they've demonstrated since we've returned, but I also want to take a moment to thank our families for the tremendous support and patience that you've shown and continue to show us. I've said from the beginning that while the preparation and the planning for our re-entry has been extremely difficult on our teachers and our faculty, they continue to do a phenomenal job to support our students and families. This educational model is extremely challenging to many families, particularly those with young children. So, but that being said, I'm so happy that we have our students back in school. And I want the public to know that we'll continue to assess our practices. We continue to revise our approaches if necessary. And I encourage families to reach out to your teachers, reach out to your principal, reach out to our office, my office, with any questions or concerns that you have. And please go to our website, our social media platforms for the most relevant, accurate information. And again, thank you for having me, Matt.
Thank you, Dr. Campbell. We appreciate all you're doing. Michelle Bratti.
Hello, hello. Just quick, as Dr. Triffletti had mentioned, the importance of a flu shot. We want to thank Osco Pharmacy, who is holding our first drive-through flu shot today at Cal. We know there are seniors that don't necessarily feel comfortable going into pharmacies or doctors' offices to get their flu vaccine. And we wanted to offer them an opportunity, a different way to feel safe, to just drive up, literally drive up and put their arm out the window. So we want to thank Osco Drug. That is filled for today because, as Dr. Triffletti had mentioned, we want to ensure that we have the high dose flu shot for our seniors, and that is what we have today. It's hit or miss on the numbers sometimes, and we got a small amount, and we're going to hold that today. But we will be holding other flu clinic drive-through flu clinics in the future. And just real quick, for those seniors that have wanted to join Zoom programming, I spoke about all the programming we have online virtually. For those that want to join programming offered at Cal or participate in virtual events from your home, but don't have a tablet or device to do so, we may be able to help you. We recognize that feelings of loneliness or isolation are common during this pandemic, and we want to help you connect to others. Please contact us at 508-830-4230 for more details about the Cal iPad Lending Program. And invest in yourself. We don't stop playing because we grow old. We grow old because we stop playing. George Bernard Shaw. I did that for you, Matt. Thank you.
Quotes. Thank you so much. We appreciate it. I want to thank all the participants for joining us today. Thank you at home for watching. And I want to close with going to our chairman of our select board for the town of Plymouth, Ken Tavares, for any last minute words. Ken?
Thank you, Matt, and thank you for hosting the program today. You've done an excellent job, as always. And I want to thank every one of the panelists for what I take away as common sense, and also explaining to us what your individual affiliations are doing. Chris, I think the schools are running well. you and your staff deserve applause for what you've done. Michelle, you know how I feel about Cal, and I am so pleased that you're open and running. Dr. Potvin, you and I get to talk a lot more these days, but I certainly look forward to your wisdom and guidance as we're going through this. And Dr. Triffletti, I think a couple more programs and you become my primary physician. I listen to you very, very carefully. But the biggest takeaway that I have today is that I want to stand next to Dr. Potvin and echo his words. And they are, I am afraid of the virus. I am not ashamed to say that. I don't think I'm weak for saying that. I think we need to be afraid and follow the advice that's being given to us and the direction. It's for our own safety. Today on the Boston channels, they were interviewing people that have the after effects of the virus. And I think some of them are worse than the virus itself. But again, I am afraid of the virus and not ashamed to say so. But I also believe that together, working together through our schools, through our state government, through our local government, through subject matter experts, that we will defeat this virus. It takes time and it's going to take patience. Again, Matt, thank you for your guidance today, much appreciated.
Thank you, Mr. Chairman, and well said. Words well said. We want to thank you all at home who are watching this 68th COVID-19 show. It's hard to believe it's 68. I actually have my 70-page notebook that they sell at Staples or other stores, and I have 2 more pages left. That's how I know it shows 68. So please join us again next week for show number 69, next Wednesday at 12 noon. And Steve Triffletti will be back next week hosting, but he'll also be on tomorrow at 6 p.m. live on PAC TV for the town meeting preview. It's an opportunity to receive and review the motions that are scheduled for the upcoming town meeting, which is scheduled for Saturday, October 17th at 8 a.m. So thank you all for watching. We'll see you next week.